Welcome to the Public Schools Roberts County January meeting. Thank everyone for participating and y'all that logged on and clicked on. We hope that you find the information informative and beneficial to you. We try to educate the boys and girls of the public schools of Robertson County. I know our attorney Grady Hunt will not be here tonight, and Randy Lawson will not be here, but they will be on the video that time. We have the agenda in front of us. Due to the agenda, we have the invocation by Mr. Henry Rourke.
But I'd ask each and every one of you to join me as I pray. This is a tough time during this pandemic. It looks like it's not getting any better. It's gonna get worse before it gets better, but I'm a true believer that God's gonna intervene and He's gonna give us what we need in due time. Our dear gracious Heavenly Father, we come at this time, dear Lord, we just ask that you be with us as we make decisions that affect so many of our students, so many of our staff, dear Lord. We just ask that we remove our selfish needs or wants or whatever, dear Lord, and that we put you first. In your heavenly name we pray, amen.
Amen. I'm going to put the agenda, it says public comments down at the bottom under closed session. We're going to move public comments to the last item under information items, and we'll discuss that as information. And then if we need to move it or feel led to move, we'll move it at that time. Any other revisions or concerns about the agenda?
If we move that to action item,
To what?
the public comment,
After we have discussion, we can.
okay.
Yeah.
I was just looking at making it part of the regional agenda.
I'm sure I understand exactly what you're saying now.
In other words, if we go ahead and make it an action item, we can vote it up or vote it down and be done with it.
Yeah.
It's already part of board procedures, so the only question is, when do we return that we accept the public in? So it doesn't need to be a vote in terms of if, it's the only question, right?
Well, we got two different issues. You got, when you say public comments, there's some, Dr. Manuel, there's some people that want to come to the meeting.
Right.
And then there's some people that want to speak through the 3-minute public comments. So I don't know if we want to split those two, when we're going to open it up for the public to come, or when we're going to open it up for somebody to come and sign up and give the 3 minutes. I'm trying to address, we can address both of them, Dr. Williamson, but it's all under public comments, the way I look at it. Are y'all good with that? And if we feel like we need to move it, Henry will just move it.
Okay.
Okay? Anything else? Can I get adoption of the revised agenda?
So move, Mr. Chairman.
Second.
Have a motion by Brenda, second by Mr. Gentry for the revised agenda. All in favor say aye.
Aye.
Opposed? Motion passed. Have approval of minutes, open session.
Approval, Mr. Chairman.
Second.
Have approval by Ms. Brenda for open session, second by Craig. Any further discussion? All in favor say aye.
Aye.
All opposed? Motion passed. We'll move to information items. We have the School Board Appreciation Month. Dr. Freddie Williamson.
Mr. Chairman and members, pretty soon we can't say Happy New Year, but I'm gonna say Happy New Year once again.
Happy New Year.
It's January 11th. Hope that you're doing well. January has always been recognized by the North Carolina School Boards Association as School Board Members Appreciation Month. So I want to say to you, to our board, thank you. Thank you for your tireless hours, for your energy that you spend to help us make decisions for and about our students thank you for allowing the central office to do the day-to-day work that you have charged us to do. And then you monitor us and share information. I do appreciate that you do communicate directly with members of the central office so that we can resolve issues for our public, our parents, and our students. Please know, we do not take you for granted. We do not take the value and importance of your position. And again, we just want to say thank you beyond words for your service and what you do. You are true servant leaders. And then on a personal note, I appreciate the work relationship that we have established from you and me as superintendent. That's important. It's been 1 year. I've enjoyed our work relationship. We've had conversation about the issues, and that is for and about our students. So I take a personal note to say to all of you, thank you for the way that you have worked with me as superintendent. And I don't take it for granted. I'm going to give the cabinet members an opportunity to say anything. And Patty, what do we have? We have a. Don't we have something to give for them? So they're going to get a ham? A ham. Okay, they'll get a ham and before the cabinet speak, all I need to say is, I got this from America. I'm saying it right. And so we want to say, thank you so much for, yeah, I can't see it. Cabinet members, you want to address the board? They're in order, start.
Yeah, Dr. Williamson, on behalf of the cabinet and all the district office, the staff in the public school of Robinson,
Thank you, Eric.
we just want to say thank you for what you do every day. Like Dr. Williamson said, you are a servant leader. And I speak with you all the time. And when you call, I always try to make sure that, you know, I'm available, just like the other cabinet members. But we're all in this together, one team, one goal. And we appreciate what you do for the boys and girls, because that's what it's all about. It's about the 21,000 students that we serve every day, and of course, all of our employees that you help take care of. But we appreciate you, love you, and happy Appreciation Month.
Thank you, Robert.
Anyone else?
I'll speak. I just want to say ditto to what Dr. Locklear said, and I thank you for allowing me to be a part of the cabinet and to serve the public schools of Robinson County. I also want to thank you for the heads up that you give me sometimes, those lines of communication. Sometimes you help to open those communication lines and let us know of things that we may not be clear on, I may not be clear on, and it helps me to do my job even better. So thank you for everything you do and allowing me to serve in this position.
Thank you.
Thank you, Melissa.
Thank you.
And I say, same that everybody else has said, it's really a great working relationship we all have, and it takes all of us being able to be honest and open with everybody so we can move forward and do what's best for, that the children are our number one priority. So thank you very much.
Thank you.
Thank you, Eric.
Thank you all for your service to the public schools of Robinson County. And, you know, I've been here a little over 2 years now, and I enjoy working with you and, you know, moving this district forward. So thank you.
Thank you.
Again, I reiterate what everyone else has said. Thank you for this opportunity. Understand our role, that we always work together. Again, it's for that ultimate goal to make sure that we are making a difference in the lives and the boys and girls of Robinson County. So thank you.
Again, thank you. We appreciate you so much.
Thank you, Dr. Williams. Thank you. Any board members have any, I know it's our appreciation month, but any board members have anything that they want to address or say at this time?
I'd love to say thank you to our board also, because this is the best board that I've served with in my tenure on the school board. And I thank our staff and our superintendent for making my life easy, because those of you who are new don't know what it feels like to come home sometime and people sitting on your step, having to go out of the county to meet with people. It's just been a very enjoyable year with this board right here. So thank you all for everything, and superintendent and board and cabinet. God bless you.
Mr. Speaker, I'd like to say something. I'd like to say that I'm excited about this board because we can be open and honest with each other. We can talk about anything, and we don't offend each other. We give each other respect. We give each other time to speak. Our superintendent has an open door policy. I've never been to this central office that I didn't get resolution in a manner that was beneficial to the kids. And I think that's what it's going to continue to take for us to move forward.
Anybody else? Terry?
Very quickly, I appreciate all of the recognition tonight, and I think I can speak with many of my colleagues when I say that that it's definitely a labor of love, but what we do is nothing compared to what goes on at those schools every day, especially right now with those teachers and those staff members at those schools. So if there was any way I could defer my appreciation for today, I would definitely like to defer it to those individuals because they're the ones on the front lines. Appreciate it.
Good point. Dwayne?
Yeah, Mike, I've been on the board 12 years and it's been a trial at times, but I don't regret anything that I've done and serving on this board right here. And I don't think really people understand what all is entitled to being a board member. You know, it's almost like that little crew that goes to Hardee's on Saturday morning that saves the world, and then you go home and you don't hear nothing else about it, not the next Saturday. You know, but I appreciate the teachers, custodians, everybody that's involved, the confidence that they've had in me to know that I've always been available for them. And, you know, it makes you feel good to know that when, you know, when you have that open line of communication with anybody in our school systems, to know that, hey, I can call and talk to Dwayne and not feel tensed and know that, you know, that I've got that relationship out there, you know, with them, and know that if I can help them, I would help them, you know, any form or fashion. I'd give 110%. And I know it's difficult times right now, but I'm above and beyond 110% to try to help them, even if it's nothing but a phone call and just to listen to them talk right now, because I know it's difficult and it's tough, and it's not going unnoticed. So I'm still available and I'm still here, and I'm here to support them and help anybody in any way I can.
Thank you, Dwayne. Craig?
Sometimes all it takes from where we sit, in my opinion, is just that listening part. You might not give people a solution. They just want somebody to talk to. And with everybody we deal with, I'm going to just say with this board here and the cabinet, central office staff, just being able to communicate and talk, because I feel like I can pick up the phone and call anybody on this board at any time. I said that before, anybody in this cabinet, and we might not agree, but we're going to sit and talk about it. And calling people at the central office, and when you call the central office, you want an answer. And of course, I'm appreciative of everybody in the staff, what they're doing in the county. And again, we're still going through those times that we talked about 2 years ago that we've never been through. We're still going through them, and we don't know how long they're going to last. But again, the collaboration and just being able to talk, you know, we can disagree. That's fine. But at least we can sit down and talk about it, and I think that's extremely important.
Mr. Gentry?
I'd just like to say as a new board member, I have gained a new perspective and a new appreciation for educators, and every one of us in here is an educator. But I was in the system as a teacher and administrator for 30 years, and I believe that I'm able to bring that experience to the table. But again, I'd just like to reiterate all of the help that I've gotten as someone who is going through a learning curve. Everyone has been so easy to work with, and cooperation, just very enlightening and enjoyable experience.
Anybody else? John?
I'll say thank you to all the board members, to the superintendent and his cabinet. Appreciate all the things that y'all do for us. I'm glad that we can come together as a board and make the best decision for our kids and leave our personal feelings out of it. Thank y'all.
Thank you, Jim. Dr. Manuel?
I think we all, as far as the board, we're all very, very different. We all have our opinions on different issues and our knowledge base on different issues. But I think the one thing that I have seen in common that I do appreciate is that I think in our own way, we all have in mind what's best for our students, and especially in our staff and our administration. So that I appreciate. We may not all go the same way to get there, but we eventually get there. And I appreciate working with all of you, and I appreciate you putting up with my opinionated self.
Thank you. Anybody else? I'd just like to close on the appreciation part and say, as Terry alluded to, I want to thank all the employees. I want to thank the central office. And I want to thank all the teachers and the custodians and the maintenance workers for doing what they do. I talked to Charlene about it a while ago. She's had to go out and work in 2 or 3 kitchens in the last week or so. So everybody's having to pull an extra load and do what it takes to get the job done in this particular time. And I appreciate everyone putting in the extra effort without trying to get recognized or with any malice or contentment in their heart. They're doing it because they want to make the public schools the best they can be. And I believe that, and I'm sincerely grateful for everybody's effort. At this time, we'll move on. The next item is the bathroom shoes teacher of the year, Dr. Robert Locklear and Dr. Savon Malsby.
Chairman Smith, Superintendent Williamson. Tonight, we'd like to recognize one of our very own, Mr. Isaiah Stanley, an 8th grade math teacher at high school. Received his bachelor's degree from North Carolina A&T State University. Oh, Aggie Pride, right? A master's degree from the University of North Carolina, Pembroke. In his 7 years as an educator, he has taught at none other than the best middle school in the county, Lumberton Junior High School. Mike and pride. A native of Robeson County, he says, it has been a blessing to be able to teach the community in which I grew up. As the recipient of the Right Room Teacher of the Year that provides a $10,000 technology lab grant to Lumberton Junior High School, Mr. Stanley saw the opportunity as a way to help his school and the students that we just talked about, the students, to get the technology needed to be successful in today's ever-changing world. We would also like to thank his wife for being here tonight. So if you will, oh, she didn't make it. Oh, I thought she said she was here. I'm sorry. So, but we want to thank Ms. Stanley for all her support, to Mr. Stanley and his family for their continued support over his 7 years. And he has, 23 years to go. So we need a lot of support over the next years, Mr. Stanley. So, but anyway, at this time, I'd like to present to you the 2021 Rack Room Schools Teacher of the Year, Mr. Isaiah Stanley. And if our chairman and superintendent could come forward, and we'll take some pictures of Mr. Stanley.
I would like to say thank you, Superintendent, the board members. Thank you for recognizing Mr. Stanley. We appreciate all that you do for public schools of Robeson County, Lumberton Junior High. On behalf of the administrative team, students, and staff, we'd like to say congratulations to Mr. Stanley. He goes beyond when it comes to meeting the needs of our students, and we appreciate you so much, Mr. Stanley. Thank you.
Thank you. Okay, and before you speak, hi. Okay.
Superintendent. This picture.
Make it real short. I appreciate y'all for recognizing me for doing this. But like I told them before, the reason why I did it was for my school, so that we are able to get the funds that could help us grow in our community as well as get our students to grow as well. And again, I would like to say thank you.
Thank you.
Thank you. John? Craig?
Mr. Stanley, come back this way just a little. You know, I wasn't gonna let you leave.
What's the topic?
I had the opportunity, before I got on the board, I was working with a program with UNCP and the school system. Mr. Stanley was one of the teachers I went by to see, and I guess first or second year,
Yes, sir.
he was doing outstanding then, folks. And I'm gonna tell you, if you wanna see a teacher in a classroom that relates with the kids and does a great job with the kids, still teaching math, go by Lumberton Junior High and observe one of his math classes. You will enjoy being in there, and the kids just relate to him, which is so important. So I thank you for what you were doing then and what you do.
Thank you.
Thank you.
Next item on the agenda is the Robinson Healthcare Corporation bus. Mr. Jadell Hawks.
Dr. Williamson, Superintendent, Chairman of the Board, and board members. It's my pleasure to introduce on the agenda tonight Robinson Healthcare and the medical bus. With us tonight present will be Robinson Healthcare, their CEO, Mr. Hawk.
Gotta have my glasses. Chairman Smith, Superintendent Williamson, and all the board members and all the guests, thank you very much for the opportunity to just come and share with you just a few minutes, along with our staff members here, the opportunity that we are excited about. It was an opportunity for Robinson Healthcare Corporation to purchase a new medical unit that will be mobile and all within the county. We started looking at opportunities, and one of our goals that at Robinson Healthcare is we are always at the wrong end, the bottom where we should be at the top, and at the top we're at the bottom, and we got to change that. Especially around the medical, about our health, our primary health, as well as our behavioral health. We have to change that, and I believe without a doubt that one of the ways is that we start being able to access our children at an early age and have primary health go to them and being at least the opportunity to be given. So I thank you, Superintendent, for the opportunity that we can come in and we can start a collaborative effort. And in so doing that, we're hoping that we can make this project go, that we can take the health care to our schools, to our children. And just with a lot of work has already been done. However, we're very, very excited here tonight to share with you. We have got our mobile unit in finally. And like it's been affected like COVID's affected everything else. So let it be said that the unit was affected by the COVID. But we've got it in, we're excited about it, we're proud of it, and now it's time to put it to use. And I do think this is one of the wonderful opportunities that we have here in this county to start making an immediate difference in working with the school system. So we thank you, and we thank you board members for this opportunity. I'm going to ask our staff, Ms. McLam is our Chief Operating Officer, Ms. Mary Thomas Locklear is our Chief of Human Resources, Dr. Eugene Noor is our Chief Medical Officer. We have a certified, just brought on, Crystal Locklear, our certified F&P provider that will be on the mobile unit, as well as Ramona Baldwin, who is our MOA and driver of the unit. Mr. Bart Grimes, our Chief of Behavioral Health, could not be here with us. However, just for a minute, we are going to hire a behavioral health care specialist to be on the mobile unit as well to provide mental health and other type of behavioral health care needs is a possibility, and you know as well as I do, it's so prevalent within the school system now. We've got to start reaching these children with these situations, not just primary, but with the holistic type of attitude in serving ours. I can stay up here and brag on this team and brag on all your staff, but I'm going to turn it over to Ms. McLam and let her come and I will wrap this up. Thank you for the time for the presentation.
Thank you.
Good evening, everybody.
Good evening.
I am Jennifer McLean, Chief Operating Officer, patient of Robinson Healthcare, 26-year employee of Robinson Healthcare. I believe in what we do, and I too am excited about what we are proposing to do with the schools and what we've been planning to do with the schools. I echo everything Tim said, but I just want to talk to you for a minute about what we plan to do, kind of the model of what we want to do. So you saw the mobile unit that was parked across the street. If anybody got to see it, it is literally a clinic on wheels. It is a 2-exam room. It's got 2 full exam rooms in it. It's got an area for private counseling. Both of those exam rooms are private. Mr. Brewer saw it. It's also got a comfortable area for check-in. It's secure, it's safe, it's got IT capabilities. So we're very excited about that. It's very high-tech, beautiful unit that can go anywhere. So we're a federally qualified health center. And a lot of federally qualified health centers have school-based health centers. Well, we've got a rolling school-based health center that's just going to expand our efforts beyond one school. We're going to be able to go to multiple schools. And we've been working collaboratively with excellent staff of the public schools of Robeson County to plan out how to best meet the needs of the schools. We want to reduce, not truancy, but the absences from sick days. We want to help you with your vaccinations that cause kids to not be able to come back to school after so long after the first of the year. There's so many things that we want to help the schools with, but echoing what Tim said, we do want to build a culture of acceptance around health, and we believe that this is a good start, to start young with the kids, get them not afraid of health care, get them used to engaging in health care, and we believe that we're going to see the effects down the road, and Robeson County can turn it around. So that is our model. We've been working very collaboratively, and we've got a list of schools that we're going to be at on a regular basis so that the schools know we're going to be there, but also the community knows we're going to be there. Because we are a community health center, we want to be there for the community. So we will allow community members to come and partake of our services as well there on the ground. So you think about the people that don't have transportation out in Long Branch or Wakulla or somewhere like that, and they have to drive so far in. We're going to be there for them, and they can access this care. Acute care, wellness care, we're all going to be there. Dr. Norrell will talk more about that. But Robinson Healthcare has 7 primary health clinics in Robinson County that we can refer the students to and their families. So for follow-up care, if they don't have a primary medical home, we're here to be that for them. So I thank you for the opportunity to let us do this with your students, your staff, and the community members where your schools are located.
Thank you.
Good evening, everyone. I'm not quite as eloquent as Jennifer, so bear with me for a moment. But I just want to touch upon the medical services we're going to be providing students, staff of the public schools, and surrounding communities. One thing we really want to try to provide, especially for the students, are vaccinations. I'm not just talking COVID-19 vaccinations. I'm talking vaccinations so high school students can graduate. I understand that that's an issue with a lot of the high school students. They're not up to date with their meningitis vaccines, and that's something that we can provide for them. We can also provide physical examinations and update other vaccines as needed for new entrants into the school district. Just to advance into middle school and high school, we can do all of that. We'll also be able to provide acute care services. Students present with an acute illness, a sore throat, a cough, trouble breathing, wheezing. We can assess all of that on the mobile unit. And again, it's not just restricted to the students or even the staff of the schools, but even the surrounding community members as well, being a fairly qualified health center. One of the first things we are looking at doing is a vaccine event for meningitis vaccine, preferably for those high school students that need that so they can graduate. It's a very fluid situation right now. Don't have a lot of details, but it is something we are hoping we can get done, if not later this month, maybe early next month. That way those students can graduate and go on and become important citizens for the community.
Thank you. Manuel's got
I'll
a,
wait to the end.
you got a question for him or just general question?
This is, you're the medical doctor, right? It would be for him.
Go ahead.
I have a couple of questions. I thought I heard in the general beginning with Ms. McClam or with the CEO, something about behavior.
Have your help.
Okay, now, in this behavior, when you all assess them, will you do mental health records on these children that will follow them? I guess we had a concern years ago, we had a service to come in or want to come in, and they said that there was an indication they would do mental health records on children if needed, and those records would follow them. Will we be engaged in something like that?
We will not, the first assessment will be done, and then our behavioral healthcare specialists, will assess, and if there's needed additional, sessions or whatever the case may be, then that will be assessed, but no medical records.
So they will not have any mental health records going to follow them with your services now?
No, there'll be documentation, but it will not be official in a medical record.
My next question is, you talked about doing services for children. If I'm jumping the gun, tell me, okay? All right, the Medicare and Medicaid, is that how you will file for these children when they come to you, or talk about cost? Maybe somebody's going to cover this somewhere.
We accept basically all insurance carriers, and certainly probably the majority of the students will be under Medicaid, I would think, and we accept that. We accept all carriers, and being a healthcare facility, we have to accept whatever co-pays are dictated by the insurance carriers.
So if I do not have any of that, let's say I'm indigent, I don't have insurance, or maybe I have Medicare and Medicaid that I know of, maybe I haven't filed. Do you have any free services for people?
We have a sliding fee scale, and I can let Jennifer talk a little bit more about that.
I was just concerned if it was open to all the children for those physicals and whatever they need, or I have a toothache, or I don't know, whatever.
Yes, everyone. We don't turn anyone away based on their ability to pay.
Okay, thank you.
Do you have a question, Brett?
Yes.
Got a question here.
Hi, I'm familiar with your mobile because that's what we use in disaster. North Carolina Emergency Management has one of those mobile units and it's really good. My concern is the physicals. Normally our students have to pay athletics, get physical free. Would our students get them free with you all? The physicals, sports.
I'm sorry.
A physical.
Would they be free with you all?
We offer sports physicals as well.
But will they be free for our students? Because oftentimes our students get their physicals free.
Everything goes through the insurance carrier, and we have to accept whatever co-pays are necessary through those insurance carriers. Certainly, if students have money to pay the visit when they see us on the mobile unit, we understand that, and so that would just be billed out sometime thereafter.
All right, thank you.
Any other comments or questions? Okay, who's next? Do you have a comment?
Well, I'm going to wrap it up for Robinson Healthcare. And in terms of the staff, you represent part of our staff already. And I'm very proud of this staff. You've got two of the best there is. And they're going to take care of your children. I can tell you that they got some of the best customer service that in the corporation, these two, and Miss Crystal is very competent. Actually, everywhere she goes, they want to keep her at her site and don't want her to do the mobile unit. And so we are going to staff, as Mr. Hall said, a certified clinical counselor, and an LPN will be on the site as well. This relationship that we have formed with the school, I do want to give credit to Miss Stephanie Locklear, who was here prior to. I've worked with Miss Stephanie for years, and it has been a wonderful relationship. And your team that you have right now has been exceptional to work with. It's just really wonderful, the working relationship between the two agencies. And we were very blessed to do over 800 vaccinations through an agreement with the school system. And we thank you for that. We thank you that we were a service to the school system. I am a product of the Robeson County Public School System, and I do know how hard and what the teachers and what they put into, their energies that they put into the students and the education. So what we also have done offer to the team is our expertise in terms of training when necessary. We're certified and trained in several different areas, so we often have mentioned that we can do training free of charge to your educators, to your students. So whatever we can do to be, a support to you, we're more than, we don't mind. We're here for you. I'm a certified life coach and health coach. I offer my services free of charge when necessary to do any training, or if there's a student that may need some life coaching or health coaching. So we're here. We're here just to support the public school system and to do the best we can in serving you. Again, I echo everything my team has said, and we appreciate everything that you do for our community.
Before you, Mr. Holt, was when Dr. Manuel had her hand up. Go ahead.
I just want to make a statement. I've known and been associated with Robeson Healthcare for years. They have an impeccable reputation, and I know Mary quite well. And I just wanted to say that my questions a while ago was not anything derogatory, it was just clarification. And I do want to always say that they have always stood by their word. They've been helping the community. I don't know, how many years have they been in business?
Whoa, 36 years.
36 years, and I've had experience with them in my job before. I went to heaven in retirement. But I do say I want to commend them on what they do for the community, and thank you so much for being here.
Thank you, ma'am.
Monte's got a question.
Yes, my question, I heard you say, would you be at all schools or just some schools? Let's get a clarification on that.
There's a list, Mr. Dale, if you want to take that, we asked the school system to pick the schools that we could best serve at, instead of us picking the schools, so.
In order to service areas that didn't have a brick and mortar building or a medical facility nearby, we chose schools that were in areas that could not access it because of transportation. So the schools that are going to receive a full day would be Littlefield, Magnolia, Rex Renner, and Orem. Then in a rotation will be Oxnard and Long Branch. And with them having just one mobile unit, piloting, seeing how it goes, before we extend it out to other schools, these are the schools that were in proximity, did not have a brick and mortar location to go to.
Dale.
Healthcare brick and mortar. We have
Yes, sir.
the seven,
Yes, ma'am.
yeah, that's okay. We have 7 medical centers. So in Maxton for Townsend, we're right down the street.
Yeah, you got one in Red Springs as well.
Yeah, right.
St. Paul.
You got one right outside of Lumberton here. But Jadelle, those schools you just mentioned, how will we publicize them? Would the school send out a call center thing, or how do we let somebody know that the services will be at that particular school?
Because of COVID having to extend our services out, we had originally wanted to have everything in place by January, but it has kicked everything out. But what we have done is we're going to have a set schedule. So there's no wondering when the bus is going to be there, like Monday on Magnolia. So people and families can remember that that's when the bus is going to be there. There will be a set schedule. If anything comes up, we'll have, things with inclement weather and things like that could occur. We'll make sure we get that information out and it's sent out, like you said, through your voice or through a phone call service.
Have a follow-up question about that?
No, I just want to know how they would pick.
Any other comments?
They can put them on our website also.
Yes. I just want to say thank you for the partnership, a partnership in action that's going to have an immediate impact, and then the opportunity for growth. I can't wait till we get the second mobile bus in place. Can't wait.
You're stealing my thunder. Here's what we're doing, here's what we'll commit from Robeson Healthcare Corporation. Let's make this successful. There is no reason why we can't go out and buy more mobile units. We just need to have the needs. And so as we work together and develop a relationship, become more and more of a routine in the communities, as you see the mobile unit, the sky's the limit. The sky's the limit for all of our kids. And as we go forward with this, you have a commitment right here made before you, the board, that Robinson Healthcare, if we need more units, we will purchase more units and we'll put them to use. So thank you, Chairman. Thank you, Superintendent, for your time tonight. And let's have a wonderful year.
Craig had his hand up. You still got a question, Craig?
I have one question, just for clarification. I know you mentioned, I don't know if it's like 800 vaccines or vaccinations. That, you're talking about the vaccinations, well, let's just say not COVID.
Those were COVID vaccines.
Those were COVID?
Yes, sir.
Okay, those were COVID. Now, you can also do, in part, the vaccinations for the kids where they're sent home. You know, first grade and stuff like that, which my part on that was just, that would be a tremendous help because we get the kids that have to go home, they can't stay in school, and there might not be a way to get them to the doctor. So something like that coming on board too would be a tremendous help all over the school system.
Hopefully before they get sent home.
Yes.
We can fill that gap before they get sent home.
Okay.
We have a,
Mr. Brewer's got a question.
Will y'all be doing the COVID testing
No kind of dedicated block time testing per se, but if a patient presents with potential symptoms of COVID-19 and the healthcare provider feels they need a test, that then they will perform a test.
Any other comment? Mr. Gentry?
Are dental services included with Robinson Healthcare?
We have a dental practice right across the street. It's our first, and we're going to be expanding into Fairmont with a new construction. But right now, we don't have a mobile dental. That might be in the future. But we're getting our feet wet with this, but we can refer students, teachers, and whatnot to our practice here and the one in Fairmont when we open it. They have a sliding fee. They accept insurances, and so it's an incredible benefit for the community. But we do have it. It's just not going to be mobile at this time.
Any other comments or questions?
Force us to buy another unit. Force us to buy a dental unit.
Yeah.
Force us to do that. And because that's what we need. We can turn this. We can turn this. I promise you. Working together, we can turn this. So
I'm sure the needs are there. It's not a want list. There's a lot of needs out there.
we're gonna find that little secret, and we're going to walk right in there, and we're gonna make a difference. Thank you again for tonight.
Thank you.
Thank you.
Next item on the agenda is an update to the COVID isolation quarantine procedures. Mr. Bobby Locklear.
Good evening, Chairman Smith, Superintendent Williamson, board members, and Happy New Year to everyone. Before we left for our holiday break, we pretty much had our isolation and quarantine policy figured out. It was fairly cut and dry. If you were positive, it was 10 days. If you were exposed, it was 14. So again, that was pretty cut and dry. Well, over the holiday break, the CDC, along with the NCDHHS, revised the guidelines immediately prior to us coming back and kind of reduce some of that time in order to get, number one, our teachers back in the classroom if they were exposed and not showing symptoms and have to stay out 14 days, but also to get our kids back in the classroom because we understand children being back in the classroom face-to-face is the best place for them to be. So we, along with our nurses and along with Robinson County Health Department, we reviewed those new guidelines. And there are a lot of ifs in these guidelines, but we have reviewed these guidelines with our principals, we've reviewed them with our nurses, and we've implemented them from day one. So the biggest thing is that for both of these, the isolation period, quarantine, has been reduced to 5 days. Now, that's where the ifs begin. So if I'm positive, and again, I don't want to go into all the details, but if I'm positive and I'm not showing the symptoms after that 5th day, I can return. So that's one of the biggest things. If I'm an individual who has been exposed, then on day 5, I am required to take a COVID test, a PCR or an antigen. And then when I get my negative results back, then I can return back to the building. If I am one of those individuals who is exposed and just says, I'm not going to test, then again, we're going to go back to our old guidelines, and that's going to be an automatic 10-day quarantine for those individuals. So as the guidance changes, again, we will review that with our COVID team. I think after we met last week, the additional guidelines were put in place on Friday. We met and felt like that only caused more confusion within what was happening in our schools, and we decided not to extend some of those others. Some of the conversation that we hear from parents and doctors, and we've shared this with Southeastern and also the pediatricians in our community. Some of the confusion comes about when we impose stricter guidelines than what may be out there with the CDC and NCDHHS. And we are allowed to do that through consultation with our health department. And again, before we make any changes to this, we do consult with them and see how they feel we need to go in what direction to keep our kids and our teachers safe in the building. So the biggest thing is there's no cut and dry isolation and quarantine from the 10 and 14. There is that minimum of 5 that plays into place across all, but it comes into, do I have symptoms? When do I get that negative test? And those sort of things. And nurses are pretty clear on the expectations of these updated guidelines. Excuse me, I'm sorry. So I included at your table today, we are required to do a weekly tracking of our COVID numbers. And so I think all of us expected an increase when we return back after our holidays. So the numbers you see in front of you from January the 3rd, Cole, okay, thank you, Cole, for pulling those up. January 3rd through the 6th, for our students, we had 1,200 exposures and 294 positives. So when I looked at these, of course, these are extremely higher than what we were experiencing in the months of late October, November, and the beginning of December. So I went back and said, let's see how this compares to those first 2 to 3 weeks of school when we brought everybody back in. So these numbers are very comparable to what we were seeing late August, very beginning of September. And as you know, those first 3 weeks of school, they were high, and then that number began to drop off. Now, again, did we ever get to 0? Absolutely not. But our numbers did begin to decrease each week that we progressed all the way up to the holidays. In these numbers, just to make you aware, we had 4 athletic teams that were quarantined that will calculate into these numbers. And again, Mr. Jerome does a good job of notifying me and saying, okay, this team has to quarantine. And if they play another team in our county, then that other team is also affected as well. When we met with our principals and nurses on Thursday, we reiterated with them, employ your COVID teams. And what we mean by COVID teams, principals, nurses, we hired APs as a means to assist nurses in the COVID tracking, social workers, counselors. These individuals should be assisting our nurses in that contact tracing. Contact tracing should not be the sole responsibility of the nurses. On the back side of that particular document, a request was made to kind of get us our vaccination rate, kind of where we're at right now. And we know that the vaccination for our children, for young children, just became available right before the holidays. So according to the information I was able to pull off the dashboard, you can see that about 7% of our children ages 5 to 11 are vaccinated. In talking with Ms. Tracy from the Health Department yesterday, these numbers are not going to be 100% correct because these numbers only take into account individuals who are vaccinated at facilities that report to the state. So we do have some facilities, whether it be military, I think she shared with me, military bases, or it could be a Walmart, CVS. Those folks may not necessarily report to the state of individuals who are vaccinated. So here's where we currently stand with our vaccination rate by age group within the county. An added piece that I put at the bottom of this, the chart here, Cole, if you will scroll up a little bit. If this was a live document, you could scroll over that 7%, and then it would actually tell you that there were 886 children there. So I've indicated how many individuals fall into each individual age group to kind of give us a count. If I'm not mistaken, there's roughly about 54 to 55,000 individuals in Robeson County that have received at least one shot of the COVID vaccination. And lastly, at the bottom, we are finally below the state average. So I just checked the state average, and positivity rate was 30.5. You can see here that our positivity rate over the last 14 days has been 24.3. So again, we came back, followed the updated guidance, and we know that it has caused some bit of confusion for folks out there, especially since they released this guidance, if I'm not mistaken, they've updated it twice. But again, we have the ability, along with consulting with the health department, to say, no, we're going to continue with these stricter guidelines because we feel that's what keeps our kids and our teachers safe in our building.
Dwayne's got a question.
Yeah, so I'm gonna stand up.
Go ahead.
Because everybody needs to hear this, and everybody out there. This is, Bobby, thank you for everything. You're doing a tremendous job. The problem that we're having, okay, is that we have a child is positive, okay? Of course, they take them into the room or whatever. Then you got the trickle down effect, and help me out with this here, Bobby, to where teachers have to find out who has been exposed to that child there. And
Correct. And in our contact tracing, we are still if children are not 6 feet apart in the classroom, we are still contact tracing in the terms of front, back, right, left.
right. So what I'm getting to is one child, and you look at this right here, you have 294 positive cases, but you've got 1,203 exposures. So, and pretty much there's a lot more going on with that, but what I'm getting to is that if you have a child in your classroom that is positive, forget teaching. That teacher has got to spend more time on trying to find out who that child has been exposed to, from that classroom to whatever classroom that other child has gone to or whatever. So what I'm getting to is, I understand the exposure. I'm getting that. But when our teachers are spending more time on trying to locate on exposures than they are in teaching the class, I hope I'm making sense right here and where I'm going. And I'm telling you, I hear it every day. I hear it every day to sometimes I don't even want to answer the phone after I just sat here a while ago and said, call me. You know what I'm saying? So, but what I'm getting to is the child goes home. Child goes home. Does the child stay home? Let me help you out. No. Child's going to, he's going to Chick-fil-A. He's going to Walmart. The child's going everywhere. You see what I'm saying? And you guys help me out here. The tracking part is what's killing our teachers and our nurses and everybody. My thing is, you feel sick, stay at home and go get tested. Because you can track down to do all the exposing you want to. It might not show up for 3 or 4 or 5 days. Okay, if you're positive, you stay at home. And what I'm getting to is this is what I'm hearing right here is what everybody is struggling with right here, is doing all the tracking. You're doing so much tracking, there's no teaching going on. One child goes in a classroom and you have it in there for an hour and a half, and then boom, then that just completely stops, and then you're having to go through the tracking part. And maybe I could be wrong, but this is what I'm seeing and this is what I'm hearing. That you go to school, if you got symptoms, you get tested, you stay home. Can you make them stay at home? No, you cannot make them stay at home. If anybody in the classroom, if you got symptoms, you go get tested. If you're positive, you stay home. But what I'm getting to is the tracking part is what's taken away from the learning, the exposure stuff. I hope that makes sense. And this is what I'm hearing. I am hearing this every day. This is what's wearing our staff out, is the tracking part. So while we're on this, I want us to try to come to a happy medium here, so that way my phone don't blow up anymore, to where, okay, we get it, you're positive, we get this. But the tracking, I think we've got to come to some kind of happy medium, so that way our teachers can teach our kids and not be tracking kids down. You know, because what happens when you track them down? They've been exposed. Then what happens? Okay, they've been in contact with somebody that's been exposed. And help me out, Mr. Bobby, is that it then until they show signs, or do they have to go home then?
No, if you have an exposure in the classroom, then that individual is sent home, and on day 5, they are directed to take a test. And once they get their results back, if it's negative, they can return back to the building. If they choose not to test, then they're out for 10 days and can return on day 11.
And this is what I'm getting to. That's like a math equation. Do y'all see where I'm coming from? So we get it. We understand the seriousness of this right here. But if our teachers are going to spend more time on 7 days, 5 days, 14 days, no wonder they're more slam out. I'm more slam out from hearing it.
Give me 1 minute, Dwayne. I think the superintendent's got a comment.
I want to address that. The tracking should not be difficult if they've done what we asked. One, a seating chart on the bus.
Correct.
So we automatically, if they've done that, we know exactly the exposure issue. A seating chart in the classroom, same thing applies. We know exactly who we live. So if they've done what we've asked, tracking is not an issue. And then they don't have to determine whether it's 5, 10, or 14. That's the nurse's job, and we're clear on that. But I'm not understanding the tracking piece, because we have seating charts that make it real easy that we know. Correct, Bobby?
Correct. And so early on at the beginning of the school year, what we asked our schools principals to get to teachers is, for every classroom, you need to have a seating chart. So that if, as Mr. Smith alluded to, someone comes in and that kid says, well, Johnny's positive, all that teacher has to do is say, well, here's my seating chart. You go and track part of the COVID team. Here's where Johnny was sitting. Now, here are the 4 people, front, left, right, back, that were sitting with them. Now, if we have situations where those seating charts are not in place, then that's where the additional work that you're referring to comes into place, because now I have to go back and say, well, who was sitting where in my class on that particular day? And we do have incidences in these numbers here. Again, I think part of it, we kind of got away from what we had to be doing. There are numbers in here where we had to quarantine a bus with 60 kids because there was not a seating chart. So again, if those seating charts are in place, tracking, I'm not going to say is a breeze.
Right.
But tracking becomes, hey, I know what 4 kids I've got to go talk to because I've got that seating chart, front, left, right, back.
Just one more thing.
Go ahead.
I'll be done. give you some example. The senior high school pretty much has what, 1,900 kids, does that sound about correct up there? They're averaging over 700 kids out a day. So something's going on. And that's what I'm talking about, I think the simplicity part of it is not there when you've got that many kids that's being out of one school a day. And I'm not saying all of it's from COVID. I mean, 200 could be positive. 300 could be exposure. And then the other ones could be miscellaneous from just whatever. So I wish there could be some really good communication with the staff, and not saying that there's not, but to find out what can be done to, does that kind of make sense, Mr. Bobby?
Yes.
As far as making, because, I don't know, it's just, we just got a lot of kids in the public schools, and I guess that's what makes it so tough right now. So,
Henry's got a question. Henry's got a question.
What brought to my attention by parents was that the parent received the call, the child had come in contact and is directed to pick up the child for 5 days. At the end of 5 days, get the child tested. They did so. They spent all weekend running from town to town trying to get a COVID test. Test is negative. They carried the child to school the next day. The child's in school all day. The next day, they turned the child away. Said they got to go home for 10 days. Now the parents calling me fussing about the fact that now their employer does not want to work with them because they feel like he's just finding an excuse to get out of work. So this is creating issues with our parents. If we don't go ahead and get everything, whether we need to put a chart up or whatever it takes to get some true understanding of what, and another question was, the parent asked me, who do I contact? Now that we have restrictions in coming into the central office, who do they contact? So they're gonna have to come to a board member.
And so to address, Smith, man.
Go ahead, you fine.
So once these initial changes came in place, which was last Monday when we returned, we went through, we revised them, tweaked them just a little bit to meet our needs, got with Dr. Williamson in the cabinet, and we met with principals on Thursday, principals and nurses. We walked through the guidelines one by one and walked through and said, do you understand this? Do you understand what the if is after that 5 days? Dr. Burnett since has posted those on both our website, our updated guidance on our website and Facebook. And Facebook, we gave them, again, the chart that they have, and we also walked through an agenda to kind of walk them through the entire process. So again, it just sounds like there may need to be some more update to principals to say, ensure you're following these guidelines, because the consistency is what's going to make us make it a whole lot easier down the road. And that's why prior to 10 and 14 was clear. Now when you got that 5 and then you got some other things that fall behind that 5, that's where it kind of gets confusing. And as Mr. Smith alluded to as well, I've gotten phone calls this whole week. Well, I was exposed to my son yesterday. I'm gonna go get tested today and come back. No, that whole piece about when do I test is gonna be important as well. And so for those of you who are listening, that when to get tested, that magic number is 5. It's not the day after I'm exposed to someone, not the day I feel bad. It's that 5th day after the exposure is when you make sure you're tested.
Mr. Gentry, then Craig.
At some point, the buck's got to stop with something. And alluding back to what Henry was saying, if that student has a card or some type of confirmation that he's negative, then he ought to be able to go back to school. What I heard is that was not the case. He was turned away.
Went to school one day and the next day was refused.
That's got to be the exception rather than the norm. And if you send us, send me who and what, we investigate that.
Okay.
We have encouraged our administrators, if you have question about, to direct that to us, and they know, and they do that well, because all of us are feeling those questions, but that's an exception, and we need to know how that happens so we can correct it.
Because the child probably could have come back in contact again that day it went to school, right?
The child was exposed by another student. That's what that was.
Okay. Okay.
Craig had his hand, did you got your hand up, Terry? Did you have your hand up?
Yeah, but I can wait.
Yeah, well, I was gonna let you wait, but I just want to make sure I acknowledge you.
Yes, sir.
Okay. Did you have a follow-up, Mr. Gentry?
That answered it for me.
Craig?
Just a thought, and everything what Mr. Bobby said, they had that meeting last Thursday. And, cause I guess Dwayne, I had nothing to do, so I listened to it that morning, and they went through everything that Mr. Bobby's talking about with, I think, principals, nurses, just the whole group was on there. It was a lot of information, and I'll be honest, I was trying to write it down and keep up with it, and not saying I can do it, but now I was having trouble with it. But the tracing part has been the issue to me since school started from day one. That's been the issue that I've heard more of anything, having to try to keep up with where these kids are. And I know we've talked about the seating charge, but it seems like that caused more stress than anything else dealing with all this. And I'll just throw this out. I know that meeting last week was virtual and it was with a lot of people. And with these new guidelines, I'll just throw out if maybe we could bring 10 principals down here and at a time or something and go through this with them again. And I don't know if the nurses could come, if it could be done face to face real quick to get something back out to the schools instead of it being, on the computer. And I'm just threw out 10, it could be a different number that would help. Let me ask this question here. On this chart that we have now, where it's got COVID positive tests, that there is the number of people that was tested positive for COVID, the chart that we get.
Yes, sir.
Okay, now exposure, that's where I'm sitting next to somebody and you've confirmed that I'm exposed.
It could be two different kinds of exposure.
Okay.
It could be the front left, right back, or it could be you walk in and say, I was with my wife last night, she's positive. Now I need to go home, because then it's not necessarily an exposure from being front left, right back. It could be someone in your household is positive, and that counts as an exposure.
And to follow up to that, neither one of these takes into account, tell me if I'm wrong, somebody who is at home and has symptoms. They've not necessarily, well, they might be been exposed, but is it possible we got people that's at home with symptoms and they're not being counted on this? And I'm just throwing that out to say that could be a possibility of where we're getting all these high numbers of people being at home. Because I'm throwing that out. I don't know that that's true, but I have a symptom and it's not being counted, no way.
Correct. So the numbers that we have are the documented individuals or cases that our nurses / COVID teams have dealt with. So that either wise, I come in with my positive result and you go and you do your tracing from there. But if we've got kids that are just staying home and they have positive or symptomatic and do not call and report to the school, those individuals are not counted in this number.
How does it relate, and Terry, I'll get to you, let me ask this, because I went and got tested yesterday, and I called Craig. I got you, fantastic, Terry, okay? Now, what about somebody like me, if I've been around somebody that has been exposed or has the virus, but I've had both my shots and my booster shot? And I talked to Craig yesterday, his daughter-in-law works for some doctor, and he said as long as you wear your mask, is that correct, or how's that come into play?
Somewhat.
Somewhat.
So again, this is where they went from the very cut and dry to some ifs. So if I'm an individual and I have both my shots, but I am eligible for the booster and did not take it, then you have to quarantine. If I am what we define fully vaccinated as is having both shots and the booster, or I've had my 2 shots and I'm 5 months out from Pfizer, 6 months out from Moderna, 2 months out from J&J, then I do not have to quarantine. I just have to monitor for symptoms. So if I'm what we define as fully vaccinated, if you're fully vaccinated and exposed, you do not have to quarantine, you just monitor for symptoms. But again, we have a masking policy in place that the individual must wear a mask their entire time in the building or on the bus.
Terry, you got the floor, then Vontae, and then I'll come to you, Dwayne. Terry.
So I've also heard some concerns about contact tracing and how cumbersome it's been based on many factors. There's a lot of moving parts. But my concern is more or less about on the ground at the schools in terms of teaching. I'm here when we look on this form and we've got staff, 103 COVID positive and 99 exposures. It just says staff. You don't know if it's teachers or what, but how is it looking as far as students having subs? I've heard one situation where they couldn't find a sub at a school, and an assistant principal was having to watch 2 different classes. So just on the ground in terms of like our instruction, can an individual school choose to say, okay, we don't have enough staff, so we're going to do X this week or whatever until we can get staffed?
No, the answer to that is no, they cannot. There is, again, when we survey the region and we ask individuals, when you look at the data, please look at it as a composite, but also by individual schools, because that's what we really need to be concerned with is the individual schools. We are covered. Part of our problem is this, and Bobby, you and I've talked about it. Once a person's been exposed and it's to 5 days, we ask our employees to go get tested. That's what the state is saying. The problem that we're having and what's creating a lot of this is they refuse to go get tested. So that automatically bumps it to 10 days. That's where our problem is. That 5-day rotation takes care of itself. The real issue is, and we can be honest, right? When we ask them and what state is saying, 5 days, go get tested. A high percentage refuse to get tested. And that triggers to 5 days. That's what's creating a lot of our problem. Correct, Bobby?
Correct.
Staff members?
Yes. Yes.
I got you, Dr. Manuel, after. Are you?
I'll tell you.
I got Vontae, Dwayne, then Dr. Manuel. Are you have a follow-up, Terry? You're good.
So what is the recourse, or do we not have any when a person just says, I'm not going to do it?
We do not. We do not have any. We can't force that issue. But you need to know what we're dealing with and why that's happening. And we can talk with directors and Charlotte, we can tell the same thing. Folks are saying, no, I'm not going to get tested. It triggers it to 10 days and puts us in a bind. I'm being honest and open and transparent.
What we need. Vontae?
Yes, my question was right on the line of Terry's. I be hearing, I've been getting calls and stuff all the time from different schools. Different schools got 20 plus staff members out. That we're not talking about 1 or 2 schools. I'm getting called there several schools, 5 to 6 schools around the county. They got 20 plus staff members out. How are we handling that? Number one. And what is our number one? How are we handling that? And how are we putting, subs? What is the deal going on with putting subs and stuff in these classrooms to come here? Like Terry said, we have somebody else got to cover the classroom, where you got teachers covering 3 or 4 classrooms throughout the day. All of this is burning teachers out of stuff too, not just one thing. All of this together is burning everybody out.
We are struggling to find subs. We do combine some classes when possible. And the real answer is whatever it takes to get it covered, to do that. There is no clear provision if this conversation is about virtual learning. There is no provision that that can happen. In fact, Erica, in the budget bill, it's clear, right? That is not automatic. The only thing that is available is from the old bill that was 364. And it defines that if there is an emergency, well, if we can cover and keep kids in school, that's what we do. It says if there is an emergency that you absolutely have to close that school, you can do that as an emergency. That happened in the county for 2 schools. That was a provision that they did that under. But it also says this, as soon as you can return them back to school, you have to do that. Now, what we need and what we're really after, and again, we're meeting daily. This virus now is moving so fast. If we can stay within the 5 days, it solves our issues, and we're rotating in and out. To go virtual doesn't solve anything because it moves so fast. 5 days we can manage. The real issue is when we have to trigger the 10 days because we can't get folks. We've talked in the San Diego region, there's no one that's gone virtual other than that particular district, 2 schools, and they're gonna have to be back in 5 days. So our best bet, and again, when you look at the numbers by school, it tells us a lot. But it says we can manage those buildings by what we're doing. I mean, there's no easy answer to it. We've got to keep kids, everything that we hear from the state, to keep kids in schools. But the real issue is that our employees work with us and help us with the 5-day piece and get tested. It doesn't trigger the 10 days. That's where we're struggling.
Okay, just a follow-up. Do we know how many teachers stuff that we have out across the county? Do we have a roundabout number or something?
Not to my knowledge, other than when principals call and they call and say, I've got this out, and whatever the case might be, but.
That might be a good, that might be a good rule of thumb, just to have while we're in this pandemic, so to speak, and I hate to use that word, but with some numbers. I know, Bobby, when you and I talked today, you said we didn't really have many clusters, right? We got some sporting teams, but we don't really have a cluster. Is that correct?
As of last week.
Right. But it might be good, Dr. Williamson, to get a daily, send the principals an email and ask for a daily number of, I don't know if you want classified, certified, or
yes, I mean,
teachers or.
I think we just need something to go by. We can do.
Cafeteria, yeah. Just maybe have Mr. Burnett send that out and say, so, you know, we, people call us, they think we don't, you know, and some of it's true, some of it's not true. You hear stuff, they saying this, they saying that, I heard this, but just so we'll be aware, that's all. And let me get back to my list. Now, Dwayne, then Dr. Manuel, then Henry. Did you have your hand up, babe?
Go ahead.
I'd like to piggyback off of Dr. Williamson right there. I am 110% behind Dr. Williamson. Virtual should not even be discussed. Virtual needs to be down there in the Lumber River because they do not learn from virtual. But my main concept right here is when, and Bobby confused me a while ago with what was that you were saying about Moderna, Pfizer, and Johnson, and you kept going on that. When he got that far, I was done. And what I'm getting to on that right there is when I'm a math teacher, quote unquote, you know, dealing with this, it's like math is secondhand compared to dealing with this. You know, compared to what you're thinking, it's playing second fiddle to where we're at as far as concentrating so much on the virus and the exposure and tracing and all that stuff there. So that's my concept right there, that they're having to concentrate so much on making sure that they're doing what's right there till that's pretty much what's draining these teachers, where they can't focus so much on doing what they need to be doing. This question right here, and I remember what you said a while ago, Dr. Williamson, about being tested. Now help me out here. Mike, if you don't mind me putting you on the spot, now you went and got tested yesterday, correct?
That's correct.
How long did it take you to get tested?
Well,
When you pulled up or,
when I pulled up, they were closed.
okay,
He said we were open back up tomorrow morning at 10 o'clock. But a friend of mine happened to be there and he saw my truck and recognized me and he asked me to come back and they'd test me. So it took 10 minutes to get I did the swab thing where.
right, but I think what the main objective is when it comes time to get tested, everything is so overwhelmed as far as, I think you could do your own testing, I believe.
Yeah.
You can go to CVS or Walgreens or, help me out, does that sound correct there?
May I interject? We do not accept home tests as a means to return.
That's right.
So it has to be an antigen or a PCR.
Right.
Okay, so pretty much that's.
You have to go to a doctor, lab, some of the testing sites.
Okay,
Yes.
so has everybody, I'm assuming everybody's been, listen, I'm just gonna get to it. Who wants to go sit in line for 2 hours and get tested?
Got 7 hours.
See, that's what I'm talking about. If somebody says, well, our staff's not, I think that's what the problem is. They don't have 2 hours or 3 hours. They want to go up there and get tested. Because everybody's just getting tested. I went down 95 the other day and seen them on that side of 95 and that side of 95. And I think you can, all the way up there to Chick-fil-A just about it seemed like. So my thing is I think, no, it doesn't have to be made a little easier, but who wants to go get tested and you got to sit there for 2 hours?
All right. Let me keep the order. Dr. Manuel had her hand up. Then I'm gonna go to Brenda. I'm gonna go to Henry. And I'll go back to Terry. Dr. Manuel.
I just want to go back to Dr. Williamson's statement about refusing to go get tested. Did they go out then be on sick leave for that 10 days? Do you pay them or are they just taking their sick leave?
If they have, Erica, you want to answer that?
That's another one of those, Mr. Bobby indicated, it depends. So if the principal, depending on the position, if the teacher can remote or telework from home, for the original 5 days, yes. After that, we're telling them they have to use their own leave.
Okay.
If they cannot telework, then they would be charged their own leave. We don't have any, there's no other COVID leave that it currently exists. All of those federal mandates expire.
Now, that is if I'm refusing to take the test. That's what I'm asking.
Well, we don't really frame it that way because we don't really get into why you're out as so much as to the fact that you're out. So if you're teleworking, we have a code that we use for that, but after the 5 days, you charge your own leave unless you continue to telework. If you don't have the option to telework, you're charged your leave. It's not based on triggering your leave because of a refusal of a test, because there is no other leave. It's not an option if you were to test, say yes to the test, then there's some leave somewhere that we can use for those first 5 days. There does, no leave exists anywhere.
Yeah, well, that's being fair,
Yeah.
all you can be consistent. Brenda, you got the floor now.
Mr. Chairman, from looking at my September list to piggyback on what Mr. Bobby said, but I also want to talk about what Terry and Vontae said. Our numbers at that time was close to what Mr. Bobby said. However, we had 100 and in September we had we've got 161 teachers more out. I'm sorry, students out with COVID. But teachers, it was 16 at that time in September the 4th and 103 now. What we're dealing with and I'm dealing with, and y'all know what I work and do. We're not just dealing with our school system, we're dealing with our community also. Child got called, teacher that work in our district, for an example, had to go pick a child up from the school because the child was in school. The teacher can't go back because now the teacher's with that child. And therefore, a class is without a teacher. Not only that, it's affecting the family that child go home to. Just to use two that I know that I'm dealing with right now. They got a phone call from the school, the child, and they were able to get tested 2 days later because that's how their doctor scheduled it. Well, the child had COVID that was exposed, and the mother had COVID, which also affected 13 other families. So our teachers are overwhelmed with what they're having to deal with, and they don't know how to deal with it. Some teachers I know, and I do have some numbers as far as what teachers are, how many teachers are at different schools. When you get a lot of phone calls, you just look into it. Mr. Bobby, you know I call you in a heartbeat, I text you. And please don't ever say, I'm busy, okay? But I know I wear you out sometimes. But I want you all to be aware of what's going on. We are dealing with a system, and not just our system, but I want to talk about us, that's literally melting down before us, and there's nothing we can do about it. We cannot control this virus. Doctors are unsure about what to do. I talked to several medical doctors who are on our team. They too are puzzled about a lot of things because, like I said, it's affecting the community. We don't have the answer, but I do believe, and I'm glad you said what you said, Dr. Williamson, about those who are refusing. I sat in line. The people not showing at some of the sites to do the test, that's why sometimes it's several hours later. That's one of the problems, because I went myself just to see. But that was at Legion Park in Lineburg, because Lumberton was so full, like Dwayne said. Red Spring was full, St. Paul was full until they went to Lineburg, but Lineburg was full. And when you're having the nurses and doctors saying, well, we got 88 personnel out, what is our staff to do? So there's a lot of things we're dealing with that we don't have the answers for. But when you got one teacher trying to teach 3 classrooms, that's rough. And therefore, it's burning them down. They will melt down. What we can do, I don't know, but I do know this year. I'm looking for a babysitter if I have to go back and teach myself or manage that classroom. We don't have an answer. And I thank God for the dialogue that I'm hearing around this table, because I know all of us care. And I know. Because we don't know if we'll get it. I have a family right now, my siblings, 7 of them tested positive, fully vaccinated and boosted. Out of them was 92 with the children and grandchildren. At the holiday, I don't go. They don't come to my house. They can come. We got to do stuff on the outside. I work with too many people. And I believe that if those who are doing things like that, if they would just stop for a moment just to help this thing die down, or cease to something, because we can't do it by ourselves. We just can't. Anyway, that's I wanted to share that because I told the staff I would share my concerns concerning it. Dr. Williamson have told us we cannot do virtual. I'm satisfied with that, but I don't know how we're going to feed our staff when they have to keep going back out from being exposed.
Henry, you got the floor now.
I wanted to expound a little bit on Dr. Manuel's comment. For clarification reasons for our staff, the 5 days, we're going to work with our staff to make that time up if they're willing to do that. In any way, like ball game duty or after school tutoring or what, just example. But anything after 5 days will be sick pay. And what was brought to my attention was that this board voted that in, and I just wanted clarification to our staff members that that's a state thing, right?
No, I'm sorry.
Go ahead, Eric.
You can't really say it's a state or anything. There's no leave. The federal government issued mandates for us early in the pandemic that required us to provide leave that they were offering and would cover the cost. That leave doesn't exist anymore. It expired.
Right.
Originally expired June 30th. We could voluntarily extend it till September 30th, which PSRC did. We did extend it till then, but since September 30th, there's no way that allows us to give leave.
Right.
There's nothing, no measure in place federally or statewide.
Right.
And PSRC cannot make up their own rule to do so.
Exactly.
Terry, you got the floor now.
So I have a couple of comments and a question. Mr. Bobby, I think Vontae requested earlier that we see the numbers of teachers that were out at each school, on some sort of ongoing basis. I think that would be helpful. But I think it would also be, for me, it would be a little bit easier to conceptualize if we saw percentages, rather than numbers. Because, if you say there's 10 people out over here and 10 people out over here, that may be half of their staff, and it may be 1% of those. See? So if we could get those percentages, I think it would help a little bit more. And also, I'm sorry.
Could I ask for a point of clarity there? So as Mr. Smith indicated earlier, he mentioned, did you want classified, certified? Because when you look at the staff,
and you say 50%,
Teaching.
or is that teaching only,
Yeah,
teachers
I mean,
only, certified?
Is that what you were talking about, Mr. Vontae?
Okay.
Yeah.
Then are
And
you
the
asking
support-
related only?
Yes, just the support, teachers and like the support staff, we might need all of it, though, certified and classified. Cause you got some TAs, you got some academic coach, you got a lot of stuff that supports.
Whatever, I think whatever way you choose to send it to us, just want to see what our impact is at the school.
And is that COVID only?
Because a lot of absenteeism is not.
That's a very good point.
Very interesting.
Well, you're absolutely right.
Sometimes we don't know. Sometimes they just turn in a sick day, but they could be at home positive with COVID, so we would have no way to link that.
Well, we don't, all we want is the numbers. We'll just have to, we understand that they not bad just taking a sick day because they don't want to work that day. We can't relate everything to COVID. We just want the numbers to know that at Lumber Senior High School today, there was 80 teachers out.
Yeah.
And 4 or 5 cafeteria, whatever, they can break it down. I don't know if you want, and then like Terry said, if it's a percentage of the total population. Bobby, if y'all can do that. I got you in a minute. Craig, did you have a follow-up question then?
One more thing. So with testing countywide, there's issues waiting, in line and getting back results. I tested at a Walgreens last Wednesday, and I still haven't received my results. But I was able to get a rapid test, and I'm good to go, or else I wouldn't be here. So, which leads to my question, is there any way that we as a system can purchase X number of rapid tests and provide those? Or, maybe work with somebody like Robinson Healthcare to provide those to sort of mitigate the situation that we're having right now with testing? Is that an option?
The medical field.
If I may.
Go ahead, Eric.
I don't know, honestly, if that's an option, but the reason there's an issue with testing right now is the medical places where they get their tests from the state, there's a shortage. So we would add to that issue if we tried to put in to also request those tests, because they'll tell you there's a limited number of tests they can provide each day because where they get their supply from is limited right now. So that's a larger issue outside of anything we can control.
Let me keep it getting on. I got Brenda had a thought, huh?
My concern was just the classroom teachers, because that's who I'm hearing so much from. So many teachers out. So I would look for a list that's for the teachers, for classroom teachers. Is that what you were saying?
Yeah, I just think we just need some type of list to see who's out.
Okay, Craig, we're gonna try to wrap this thing up. Craig, I got you and then I got Dwayne.
I was just gonna ask, with what we've listened to the last 30 minutes, if Dr. Williamson, the cabinet, to me, there's enough been put out. There's a lot of things that if y'all could come together, and I know you meet and talk every day, and just get us some information that you can get out to the schools, and I know it's been put out. We just might need to do it again.
Yeah.
And keep doing it because, we can't make subs. We can't make sub bus drivers. And those numbers are just what it is. Covering 2 classes with one person, it's just reality. It's not good. We don't like it, but right now it's just reality. But any information y'all could come together and just bring back to us would help. And reemphasizing that tracing as far as how it's done. We've heard that since last year. You got to do this and you got to do that, but maybe it just needs to be talked about now. We all, I'm going to say for lack of a better word, a little hysterical because of this Omicron, and if I'm saying it right, and everybody's getting sick. And it's just a problem, but it's the reality. So whatever y'all can bring back to us, I think would be beneficial to us and to the school system.
Exactly.
Dwayne?
I'll make this quick. And if we really look at the big picture, the virus is being brought into the school, all the schools. It's not like it's there and it's being carried out.
Mm-hmm.
It's like the after effects that's being brought into the school right here. And the second, I didn't mean to be hard a while ago if I got hard. It wasn't about being hard or anything. But the main objective right here is that it's all coming down to the tracing. To when, you know, I get it, but I don't quite get it, in other words. They're doing the tracing, they're doing the follow-up, they're doing everything they need to do, but they can't teach. That's my main objective right there. So do they need to teach, or do they need to worry about this? Or do we need to try to find somebody and see if we can't hire somebody to run around the schools and take care of the tracing and everything else?
Bobby?
That kind of makes sense. I mean, that's, you know what I'm saying?
May I address that? Ms. Erica may follow up as well. We have posted CNAs since the beginning of school, and their sole responsibility would be to contact tracing, and we've yet to hire anyone.
Are you putting it on the right? No,
We've
I'm kidding.
We have 7 for tonight's, personnel packet, and we need 52,
Is it 50?
something like that. We cannot find human bodies who will work.
Right.
Some have posted 6 additional nursing positions, have yet to fill, they've been offered and declined several times.
Because of the pay.
That's what, that was the next thing.
That's the pay.
Is it because of the pay?
It's the pay.
There's
All of it's
probably a
not
lot-
paid, because I talked to a lot of them, all of it is not paid. Some people, it's just for Fred. It's fear.
Okay. Any other comments or questions? Anything else, Bobby, on your part?
Got one right here.
Mr. Ernie?
Mr. Chairman, I think we're doing a good job, not from what Dr. Williamson and Mr. Bobby shared. The tracking part, the tracing part, I can understand, and that's opened my eyes as far as from a teacher's perspective. But the plans that they've implemented in place to try to shorten up the tracing, I think it's just a matter of practice.
Exactly.
And don't quit. The worst thing you can do is send fear out of this room tonight.
Right.
COVID is nothing more than the flood that came that time. And we're all sitting here, we overcome the flood. We need to work together like you're doing. Keep your dialogue up, because that's the communication that you're doing right now is what it's going to take to solve your problem. And like I'm glad to hear that everybody's open and can work together, agree to disagree and all that. But to me, the answers are right here among us. We just need to get this relayed to all employees, where they all get that spirit that he's trying to keep us focused on. One team, one goal. If everybody in the school system would start thinking that way, you wouldn't be having all of the problems you're having now. And that's the key. Practice. And that's all I want to say.
Yeah, well, that's a good job. Thank you.
Mr. Chairman, to close this out, Bobby and I have looked, and we're looking at our calendar to see if we can give our employees, a date change, something, and we think we can with that, and so we'll get that out. So we're looking at that. Mr. Smith, I appreciate you raising the other side of not being tested, the long lines, that's a valid point, no question about that. So I appreciate raising that issue. We do have an obligation to working parents. That's part of this ongoing conversation that we have to be mindful of. And I want to close it by being clear to our employees and to everyone. We are concerned about their well-being. We are concerned about safety, all of those issues. And I want individuals to know that and believe that. The conversation is variables out of everybody's control. That's the real conversation. Everything we've talked about tonight are variables out of everybody's control. And they're going to always exist.
Exactly.
And over time, those variables will get smaller. We've all heard that maybe it's peaking or we peak next week. So hopefully we can begin to see a decline. But I don't want any employee, any parent, anyone to think that we are not sensitive to this conversation.
That's right.
That we're not concerned about safety and well-being. We are. But we're bound by policy procedures, what we can and cannot do. But we do care, no question about it.
That's right.
One thing, Mike, and one thing that I think everybody is just struggling with more than anything is patience. Because we've been patient for over 2 years, going on 2 years. And I think it's just, that's the tough, well, we can be patient. And after a while, you get tired of being patient. And I think that's what it's all coming down to right there. And it's just hard when you go in and you're trying to give somebody support and it's like, I don't want support anymore. I want it to just go away. You know, and I think that's what everybody is just really struggling with. It's just hard to be patient. I'm done.
Thank everybody for their input and your concerns and your conversation, and I think it's some very good dialogue. One of the key words that I remember early on in this pandemic, Dr. Williamson alluded to it in some of his comments, this is fluid. It's not here, it's fluid, it's moving, it's a moving target. It moves from week to week, 5 days to 10 days. So it's a process. We got to work and be patient and work through it and do the best we can each day for the boys and girls of the public schools of Robeson County. No matter what your capacity is, if you're a bus driver, custodian, TA, or whatever, we all have a duty to do the best that we can each day for the public schools. Terry?
I got one question and I won't ask any more, maybe. Is there anything that we can do to take some of the paperwork off teachers? I know, there was issues with paperwork and procedural things and procedural matters before COVID. And I think that this has exacerbated that situation. So, and while we're going through the district transformation, so that's a new piece too. While we're going through that transformation and with our processes and with what Mr. Smith was talking about, if there's any way that we can streamline things using technology, using any means necessary, while we're doing our day-to-day operations, if there's any way that we can streamline those things for teachers, I think that would be appreciated.
Yeah, we're trying to do that through technology. We're providing, and help me, Bobby, for every teacher, a Chromebook or a laptop so that they can spread some of that work out over time. And so we are, I would say that they have less paper work now, whether that's that we're requiring, let me put it that way. Robert, you may want to speak to that.
Yes, sir.
We've already started that process of how can we use technology? And then after our work with the technology, all of that, but how?
Because everything now is on Canvas, so, they have that learning management system, but we require very little paperwork. Some things have to be hard copies, but everything is electronic, so even with our staff development, all the prior approvals and service forms that teachers have to fill out.
Okay.
So we're.
Thank you. Thank you, Bob. Thank you, Dr. Winston.
Yes.
To the next item on the agenda, cafeteria health inspections, Charlene Locklear.
Glad you were patient with us.
Good evening, Dr. Williamson, Chairman. Our cafeterias, I have 4 cafeterias that score 100% on their in December. To give you a little bit of detail or feedback on our cafeterias, school cafeterias inspections are prepared by our local health department 2 to 4 times in a school year. Inspections are a part of the FDA food code. Grade A inspections are a result of the clean, up to code, and free of violations. Inspections consist of 56 inspection items, including cooking, holding, storage temperatures, and properly working equipment. All our cafeterias maintain a HACCP plan that is a management system in which Food safety is addressed through the analysis and control of biological, chemical, and physical hazards from raw material production, procurement, and handling to manufacturing, distribution, and the consumption of the finished products. On behalf of our cafeterias, Long Branch Elementary, Union Elementary, Southside, Ashpole Elementary, and Tanglewood all received 100%. Wow.
Arlene, why Red Springs High School no inspection in current year? Why was there no?
The health inspection, had not had an opportunity to get around to them since, July.
Okay,
And they have been short-staffed.
okay. I was just curious.
In Scotland County, they're working two counties. That's what he told me about ours.
All right.
Mr. Chairman, and again, you do have two documents. You have the 100% and then the grades of everyone else. So you have two documents to that. I do want to share with the board, Bobby and I met with Colleen today. She was at Red Springs in the cafeteria, so we had to walk around, trying to plan ahead in terms of are we at risk of not being able to feed our students, all of that, and what would be our backup plan. Charlene, you want to share how we ended that conversation?
We discussed today that, currently I try to move around a couple people to schools. Unfortunately, we are still, in a no sub cafeteria assistance available. So right now, with having the cafeteria closed down, I am bringing out the office staff. We go out, we, prepare the meals and feed the students ourselves. But in the future, when I talk to Dr. Williamson, high schools are coming up with some testing, days next 2 weeks. So maybe I could pull from those staff if I did have a situation of continuing to close schools.
And then we talked about the prepackaged option of when you deliver meals. That is not possible at this time. Why?
Yes, sir. I did not bid that item out on our procurement. So, but we were able to get that worked in for a couple of days coming up, the 24th and 25th, and then another virtual day. Our vendor was successful in being able to find some products for us to be able to serve the students while they were out.
Mr. Chairman,
Yes, ma'am.
I retired 9 years ago and I said I'm a volunteer since and don't get paid except through the Lord. Miss Charlene, as a board member, like I said, I'm working with someone to start babysitting. How can we help you on a volunteer basis? Those of us that can, not all board members, some of them work.
Dr. Williamson and Mr. Bobby asked me the same question today. We still are preparing and packaging meals. So the only thing that I could allow someone to do is to come in, give you a pair of gloves, allow you to pass out the meal and components, and the meal service part of it, because it is in a bag and it's already prepared. And we've already secured to make sure that the whole meal components are together and that we are serving a reimbursable meal.
Mr. Chairman, follow up.
Go ahead.
Is there a training? I know years ago there used to be a training that you could take in situations for if you had to do like hurricanes or anything like that. Is there a training still in place that you could take future needs just in case?
There is, it's food handling, but, right now, of course, the health department is not offering the course. It is online, it is a fee. There's things that just changed so much in that field. Now, I offer ServSafe for my managers, to be able to keep them, certified.
And the same thing with the TA, Dr. Williamson, our substitute teachers. We have to go through a training in order to be, because we're board members. Sometimes board members have to serve up the superintendent. I've seen that, Mike, we've seen that for some districts. Do we have to take that 2-hour course or anything like that? I'm sorry, Superintendent Williamson.
Yes, to sub, Melissa, help me, that is a requirement.
Because we may have 2 board members. We don't know what we got to do.
When is that available?
Now, are we talking about to sub in the cafeteria or?
Classrooms. Classrooms.
Classrooms, yes, the effective teachers training, and it's online.
Okay.
Anything else?
I want to say one other thing. Let's, as we look at this information, I want to say to Charlie, thank you.
Yes.
It is incredible, these scores in these trying times, in the high 90s everywhere, more schools are 100%. Thank you for your leadership and what you're doing. This is incredible.
Yes.
It is.
I might add, real quick, I went by, Union after they got the 100, and if you can get by these schools, especially that's got the 100 folks, they were so excited. And that is not easy to do. Let me tell you, these inspectors, when they go around to these cafeterias, and our schools are old, they're looking for everything. There's not, the other scores are great, but it's just not easy to do.
Next item on the agenda is the NCDPI Annual Bus Inspection Report. Dr. Robert Guzman.
Chairman Smith, Dr. Williamson, board members, thank you for having us today, allowing me to share our annual bus inspection. We were actually quite shocked this year because typically Robeson County gets inspected in the later part of the year, and so we were actually inspected in October. And we finally have received our DPI official letter of those findings, which were placed in your packets for you to review at great length. What I also provided you today was a shorter snapshot of a holistic approach of what we've been doing in transportation. So if Cole, you would go to the next one. As our transportation department, this is just always a reminder of how vast our department is. Even though we have only 258 yellow buses in our fleet and 75 activity buses, we do have a smaller amount based on the numbers of mechanics based on the number of buses that we're allotted. That is within the state guidelines, of course, that is provided to us by NCDPI. So these are also the hidden. It's real easy to see a lot of us in a mechanic on a truck, but there are office staff, there are safety inspectors or assistant directors in this Tim's office that play a vital role within this inspection, as well as the 258 bus drivers and various others that do play a role, because the bus drivers also have a reporting phase, that if they report an issue that is on a bus and it's on the books, that does not count against us. And so they play also a vital role to include the bus coordinators and everybody else associated with transportation. So it's not just those 29 faces or those 29 positions that you see behind you, as well as the principals and the bus coordinators and bus drivers. It is a large operation to go through when we have these inspections. If you would, Cole, go ahead and then go to I provided you a yearly information on those so that you can compare year to year, as well as provided our state averages. As you see in 2019, 2020, there was no inspections due to COVID. However, our inspections this year provided the following. But per DPI regulations, 10% of our fleet is inspected. So that means about 26 buses are randomly selected. There are a few that DPI automatically picks at random through their system for us to go ahead and go through each site. Now, those are 26 buses throughout the fleet. Now, they also try to make sure that it's indicative of that we hit all schools. We may not hit each school as far as a total amount, but we might hit the bigger schools or might have to pull an activity from another. If you look, we are quite proud of our 22.08 in our yellow fleet. If that score holds up, that will definitely put us within the top 10 in our region, which, as you can see consistently, last year, even though we were at a 28.23, we were only about 2 or 3 points away from being in the top 10 within our region. So for our number, that's very, very impactful, and all the hands that have to play within this inspection. So I'm very proud of our shop, as well as everybody associated with transportation, in order to garner that designation.
And Dr. Guzman says, point of reference, the lower the number, the better off we are.
Yes, I'm sorry, I apologize. It's like golf. So the lower our number, the better. We have an internal goal of shooting for a 17. Barring a couple of mechanical issues, we almost got our 17, which if we were to get in the mid to low teens, that practically puts us in the top 10 for the entire state. And for a fleet our size, that's an amazing feat. Now, I will go ahead and talk about the elephant real quick in the room of the 69.25, because I was expecting that to be a question for activity bus fleet. We inspect on random from DPI for activity buses. Now, here's the problem with activity buses. People just get on the activity buses and don't do their pre-check and don't call it in. And so as we've increased our uses of our activity buses for enrichment purposes as well, we unfortunately had one instance at one school in which, while we were on site for the inspection, a staff member came in, got on the bus, and went to move the bus without doing any pre-trip. And so, of course, that bus automatically got inspected by the DPI inspector. So that's where I also say it takes all hands. We did address with bus coordinators immediately after receiving our scores, as well as athletic directors and administrators at the schools. Since then, we're back to our normal mid-20s. And so it's one of those, you live, you learn, but you also address and move forward. That way we can go ahead and make sure we're being as safe and efficient with traveling with our students as humanly possible. So we have one of the top bus garages in the state that I really want everybody to understand the hard work and the complexity of that transportation, because that also is daily with all of the schools within our system, bus coordinators, bus drivers, and working towards receiving that. As with any report, if Cole goes to the last slide, there are NCDPI recommendations. Now, please don't tell my section chief, and I know this is being recorded, so I know he's going to find out anyway. The top three are usually ones that are always on anybody's report. So those are kind of standard ones that go through. Following improving mechanics accountability by logging time accurately in BSIP, we've addressed due to COVID and personnel changes, we have already addressed. So basically, we need to continue to have open lines of communication, make sure our bus drivers are communicating us with our TD28s, and making sure we're continuing to make sure students in public schools of Robeson County have safe and reliable transportation.
Any comments, questions? Mr. Gentry and Henry?
With the activity buses, just by their very nature, you tend to have a variety of staff driving the bus. And some, you alluded to, are more diligent about following the inspection checklist than others. Is there a session or a meeting where these drivers are educated into what is expected? Because as you well know, you might have 4 or 5 different staff members that would be driving that activity bus.
Yes, sir. We provide that to the bus coordinators to go over, and they have those meetings every year at the beginning part of the year. Also, what we do is we record those meetings. We've been recording all of our meetings this year that we've had. That way we're able to send those out as refreshers. We also make sure that we have open lines of communication with those bus coordinators and those athletic directors. I can say, as being a former athletic director, to ensure that coaches get on. And let's be honest, sometimes the coach gets there late at night, it's 1, 2 o'clock in the morning. They have all the great intention of calling it in the next morning, but sometimes those things do slip. And so we put other things in place, but yes, it's also reminding them in our monthly, quarterly, and our quarterly bus coordinators meetings. We discussed it as soon as we got our scores, met with athletic directors and bus coordinators, and it's been a constant. Remember to do your checklist. Remember to have your seating charts. Remember the disinfection and sanitization process. It's one of those, you can't say it enough, and sometimes you sound like that broken record, but unfortunately, sometimes an incident happens.
Henry?
What is the life expectancy of a bus? Is it in miles, years, and?
You have to have a combination. You have to have your 10 years and your mileage. If we don't have our mileage, the years are going to come. If we don't have our mileage, that's when we have to move a bus to another area to gain our mileage. That's why some of our buses are way older in the fleet, because if I send them to inside a township or a municipality, it's real easy for them not to get their miles because they're going short distances. We have some bus routes in which we could go to 1 or 2 apartment complexes and the whole bus is full and they have to return back to school. And so that's where TIMS and routing play a crucial role in order for us to be effective, so that we can ensure that instructional time is occurring within those buildings, and we're not the reason why that those students are being delayed.
On an average, how many do we get a year, or do we?
On average, we can go, prior to COVID, on average, we would replace anywhere from 10 to 12 buses. This year, we're looking at replacing 7. Now, the problem's going to be is the whole entire state is in a world of trouble because half of the buses that were scheduled to be replaced this year alone have not met the requirements of miles. So therefore, they have to be pushed back, which is going to eventually do a trickle down into the bus suppliers, which right now, we're looking at 1.5 years out for any buses due to parts issues as well as due just to the major demand of what's going through.
And
We're hoping that as we normalize, that process will be shortened. But as of right now, all of the buses that we're expecting to be replaced through DPI, we will have those buses during the time frame in which we will need to be able to replace those buses.
that was gonna lead into my next question. What is, the expectations within the next, say, 5 years? What do you, assume that's probably, are we gonna decline or increase?
Well, actually, what we're seeing is a decline in bus ridership. On any typical day prior to COVID, we would probably have about 10,000 students riding our buses. As of right now, the best average that we have is about 6,100. We fluctuate between 5,800 to about 6,100 students that are riding the buses. Part of that is because of an impact of COVID, but also it's due to parents want to drop them off. You have some communities where that's the community norm. And then being a former principal at all levels, you know, elementary tends to be more of the car riders. And then middle and high school sometimes ride the bus. And then, you know, high school drops off with ridership, of course, if they have the availability to go ahead and drive themselves to school.
Good job.
Thank you. Yes, sir.
Very quickly, Dr. Guzman, bring us up to speed on sanitizing, disinfecting our buses to include activity buses. And we are paying drivers extra time to do that, correct?
Correct. That is both in the morning and in the afternoon because that is done after routes. So to be honest with you, especially the kill rate on our chemicals is far superior. And so it is a great thing that if we sanitize a bus both in the morning and in the afternoon, that virus is pretty much dead. It's not happening. And our students actually, within what we're doing, we are actually safer than most public transit or anything else because we have pushed for that. Each school, each custodian has a backpack sprayer, which helps to expedite. We have the handhelds. We have the Clorox 360. And based on the chemicals that we're using, the kill rate is very, very quick. And the longevity of that kill rate is also there in order for us. We also, in some instances, have buses that are there due to the low ridership that are already ready to go so that somebody, if they needed to go ahead and to expedite a route, could jump on that bus, go ahead and utilize that one. Schools have been great. Most schools have their checklists that are there that they provide for us, as well as some schools have even gone a step further and have a red placard that says this bus has not been disinfected, do not get on. And it's right there at the door, right there, so that when the custodian is coming through, that custodian knows I need to hit that bus as well because somebody might have used it in between the timeframes of our normal sanitization.
And that includes our activity bus.
That includes our activity bus. We've worked great with Jerome. Activities, especially with sports and athletics, we've been dealing with this for COVID a lot further with athletics because of MRSA and other viruses that we've dealt with in the past. So we're well versed on this as well. And our activity buses carry the same. There's masks the students have to wear at all times, as well as the sanitization once they park that bus, that gets done.
Any other comments or questions? Thank you, Dr. Guzman, good report. Appreciate what y'all doing.
Thank you.
Thank you, Doctor.
Next item on the agenda is the construction and finance update. They met yesterday, Craig and Randy. Craig's the chairman of the finance and Randy's the chairman of the construction. We'll start with Craig.
Dr. Williamson, Superintendent, and Chairman Smith, and members of the board. As Chairman Smith said, we did have a meeting yesterday, and it's on here for information to start with. The state allotted $395 million available in grants this year. due to increased lottery funds. And these grants are these need-based grants. And folks, this is the grant that we applied for 2 years ago, and we received 15 million, which we haven't used yet. And with these new grants that's been approved for this year, we could have 30 million for elementary schools, 40 for middle, and 50 million for high schools. So, and the grant funds can be used for new buildings, additions, repairs, and renovations. And there have been some other changes in the grants. What the key to this year, if you look on what you see on your agenda, these grants are due by March the 15th of 2022. And we're looking at applying for an additional 35 million, which along with the 15 million, if we receive this, would give us 50 million. Now, let me say this now, this is dealing with needs-based grant. Just get FEMA out of our mind. We're not dealing with FEMA. This is no FEMA money. That's totally separate. So again, the key on this is the due date for application is March the 15th. You see on here also SF&L architectural firm, they have helped when we did the first grant on the needs-based application. That's why they're listed here. And we do need assistance in helping put that grant together and having some plans, and they have this information. And then we were looking yesterday at talking about a new tech career center, science, technology, and planetarium facility. That's what this money would be used for. And also this request for quote architectural design firm, you have to have a building. We have some plans, but we need something updated, which would be a new design. That's real quick what was discussed. Now, with the deadline here being March the 15th, and before I go any farther about asking a question, does anyone have a question about what's on here? This part here, does anyone have a question? I know that was very brief, but if you have a question, I'll try to answer it, or Dr. Williamson, Mike probably can.
I think that, do we need to include for clarification for people that didn't make it says new tech center, career tech center science. Do we need to include the planetarium on that, Dr. Williamson or Craig?
It's on there.
I know there.
It's on there.
Yeah.
All of them's on there.
Oh, I didn't see it.
And I didn't mention here, along with
Oh, yeah, I see it.
the 50 million or 35 million we're trying to get, we've already been awarded 5 million for a new planetarium. That come along with the new state budget. So the 5 million is there for a new planetarium. That's already been awarded.
And Mr.
Dante's got a question.
Yes, I got a question for you, Mr. Craig. The one that said request for quote for architect design firm. We didn't get into that, did we?
We did not do that. We talked about it last night, but we didn't put down about doing it. Mr. Vontae, I'll give you a little something. Dr. Williamson might can do more. It's if we go ahead and would get that approved tonight, it would just speed up the process instead of having to wait with that March the 15th deadline. So Dr. Williamson probably can add more to that.
That's correct. That is not committing to design firm at this point.
Okay.
It simply speeds up the process. Grady, are you on the line?
I am, and it technically it's a request for qualifications.
Okay, I just want to just sure.
Brenda, you have a question?
I was gonna tell Mr. Craig, and because we already have the land. The land will not be included, it's already own the land already. For the 50 million.
Yes, we have land.
Right.
Okay.
Any other questions? Okay, Mr. Grady, I was going to ask, I wanted to make a motion to move these items to an action item so we could act on them tonight so they could get started with working on the grant. And Mr. Grady, there's 3 things here. Do we need a motion on each one of these?
So we need we can move everything in one motion to action. When we get to voting on them and under action items, we probably need to parse them out separately.
Okay. I'd like to make a motion that we move these items, its own information dealing with the technology center, that we move all this to an action item.
Second.
We set aside policy.
I'm sorry. I make a motion that we set aside policy to move to an action item.
Okay, we have a motion by Craig, second by Mr. Gentry. Any further discussion? All in favor say aye.
Aye.
All opposed? Motion passed. Okay.
Yeah, I try to take each one separate. The second line there, I make a motion that we use SF&L architectural firm to assist us with the needs-based grant application.
Second.
Is that, I was at the meeting last night, let me make sure I understand, is that the one that cannot exceed Grady, or is that?
That
That's correct.
can exceed $50,000 and is, and a second motion that needs to be made after this motion is that the board exempts based on the time limitations, exempts this project from the requirements pursuant to 143-64.32, which allows the board to get professional contracts under $50,000 in certain instances, and I think this instance would apply because of the time limitation. There's just no way to go out for RFQ and have everything in place and be ready for that March 15th deadline.
Grady, was that 143-64-32?
143-64.32, yes.
And that's saying that the limit on this will be 50,000 also? Is that correct? That needs to be included?
No more than 50,000. As long as we refer to the particular statute, it covers them out.
Okay. Let me try this again. I make a motion that we accept SF&L architectural firm to assist with the needs-based grant application under the law 143-64.32. And again, it would not exceed 50,000.
Second.
I have a motion by Craig, second by Henry. Any further discussion? All in favor say aye.
Aye.
Opposed?
Okay. The next one, motion for a new career center, science, technology, and planetarium facility.
Second.
I have a motion by Craig, second by Henry. Any further discussion? All in favor say aye.
Aye.
All opposed? Motion passed.
And the last one, a motion to request a RFQ, architect design firm to, as far as giving us, information as far as helping to, and Mr. Grady, am I saying this right, just in the design of the building?
The design of the facility, yes.
Design of this facility.
Second.
I have a motion by Craig, second by Henry. Discussion?
Discuss, yeah. All right, it's a request, a quote. Who are we requesting a quote from? Yeah, who requesting a quote from? Anybody?
Requesting qualifications,
Okay,
Monte.
I got you.
Anybody.
In other words, all we're trying to do now is get firms that qualify
I got you.
to design it. Yes. No pricing.
Okay.
Do you have a comment, Mr. Williamson? You good?
Yes.
Okay. Craig, you have anything else?
No, sir.
We
Just
voted
vote on-
on that, huh?
Need to vote on that last one.
Okay.
Gotta vote.
Have a motion by Craig, second by Henry, for request for quote architect design firm. Any further discussion? All in favor, say aye.
Aye.
Opposed? Motion passed.
Thank you.
Thank you, Mr. Craig.
Thank you, Mr. Randy.
You have anything else, Randy?
That's it.
Okay.
Thank you to all of you on this action. It's going to help in the process.
Next item on the agenda was the curriculum committee update, Dr. Manuel.
Well, you're gonna, go ahead. I'll go after you. Go ahead. I'm used to being second. Go ahead. We met last Thursday, January the 6th, and I want to thank everyone who took part in it. And before I begin, it would probably take us to about 1 o'clock in the morning to go through the summary, but I'll just do a few lines. But I would request that Mr. Terry and Mr. Vontae would just make a comment before I just run through some things right quickly. Terry, you over here? Go ahead, Mr. Vontae.
I'm gonna let you talk about it. Hey,
Mr. Terry, you want to say something?
never mind to you.
Oh, you.
Mr. Craig?
Nah. Good.
That's just like a man, isn't it? Okay, we met, and I want to first of all say that the superintendent, Dr. Robert, and all the other staff, they really brought their goods to the table the other night. What they did, the whole essence of the meeting was that they came together and to show us how you could take all the data and make a diagnostic prediction and a prescription as to what to do to move the school system forward with test scores and also with academic achievement. They used ClassWorks, and I think that was really amazing, that what they would do is if a child, they would show the strengths and weaknesses, and then they would turn around and show, okay, here's a lesson plan, you can address that. And I'm cutting it all short to say that all the reports that you get of how children are doing, they have this software that teachers can go on there and just plot it out. In other words, you shouldn't have any problems if you're struggling as to how to address needs of children. You can also have target populations as you can address whatever group, where are they struggling, what are they doing, da-da-da-da-da-da. But one thing that was very impressive is that the leadership that I saw, and we all saw that were here, that the group produced, is when the principal understands this process and they see what's going on, they can use fidelity in what they're doing with their school, with their teachers, and those that are to take that data and sit down and develop what is it we're going to do. It's a so what. Like you get something, you say so what. So if the principals have been training, they're being trained through this relay program, 12 schools, on the so what. And we had a demonstration by St. Paul's Elementary principal, Miss Graham, newlywed Miss Graham, and her staff, and they took the so what, and they showed us what to do when they got all that data, and they walked us through it, and we were totally amazed. But like I said, it would maybe the superintendent would consider when we had our next workshop, retreat, whatever you want to call it, that we could actually go through most of this. But it was really an eye-opener to see how all this could be simplified, and hopefully the principals are getting the gist of it. I think my concern was not with anything presented, it was absolutely astronomical, presented expertly, was with the fidelity. And I just want to ask the superintendent just briefly, and he made some comments when we talked about the fidelity, what he said the other night about that part. In other words, when you talked about you had started and they had started and you saw it improving and your hopes were to what? With the relay training fidelity.
Can I be honest?
Yes, sir.
I don't remember what I
Makeups. In other words, with fidelity and the relay training, your hopes are to do what with it?
Let's make something up.
help me out, what did I say?
You know, our goal is to, at the end of 3 years, that all of our schools have gone through the relay training.
Yes, sir.
So that we can make sure that all of our students' needs are being met. And the demonstration you saw the other night is exactly what we are looking for in every one of our schools. The fidelity can be there if we accept our role, like Ms. Graham did the other night, and move forward. And that's going to happen. And that's what Dr. Williamson was alluding to, is that the 12 schools that have already been trained, everybody's not going to be on the same page. Ms. Amanda is probably in the top 3, but there are others that are right behind her. But it's going to take time, and that's what I said, 3 to 4 years, to see a major shift in the instructional leadership in our school buildings.
We believe in it so much.
Yeah.
The original contract was for 3 years, 12 schools per year. the results that we're getting out of the 12, we were talking with Relay today. Our intent is to double up, get the other 24, and actually 25 with Southside next year trained, so that we can accelerate that process and not have to wait over time to see the results.
That's right. In other words, it was bringing everything together the other night, all the data, all the tests the kids have taken, looking at it and doing the so what, prescribing what to do, but it's somewhere where teachers can go. It's like a depot. You can go and look and decide what you're going to do, and it will spell it out what you need to do, everything. And I think the staff did an absolutely marvelous job presenting that. And the training with classwork is going on every Saturday to when, Robert? I'm not sure.
It's one Saturday per month, and we've had 2 sessions twice a month.
And that's the instrument they're using to do this with what now?
But it continues for the rest of the year, so we just want to make sure that, that our teachers get what they need, and that's why we had to do it on Saturday, because we didn't want to do it after school. But they are doing a good job. We had about 600 participate this past Saturday. So
Okay.
Teachers are really participating, and like Ms. Cherry made the comment about the the paperwork with classworks, everything is right there for them. So that's why I said we're cutting back on the paperwork, because everything is used through the technology.
But anyway, it was lengthy, but it was very informative, and you would have to be there to get the gist of the training. And I totally yield back to anybody else would like to say anything.
Anybody got any comments? Terry?
I have a comment to make about, the teachers are being, with the district transformation, the teachers are being required to attend some trainings on maybe once a month or something like that. Talk to us a little bit, Dr. Williamson, if you don't mind, about the additional training that they're having to attend.
As it relates to classwork,
Is it like once a month sessions, or I think it's classworks or?
Classworks.
Mm-hmm.
and it's once a month, it's on Saturday, it's for 2 hours, it's online, and we're paying a stipend for folks to attend that.
Is there any way that we can have like a video for them to go back and review rather than having to be attending at a certain time? I know it's online and I know we're paying them, but just trying to be a little bit more flexible if possible.
Well, what we've done is we offer that training on Saturday at multiple times. And then it takes, we ask folks if you absolutely can, if you reach out to Dr. Carr or someone, but it is recorded. And wanted to qualify for the license to attend. But we offer, 3 or 4 sessions per Saturday to try to work with folks. And again, it's only
Hour and 15 minutes.
but we look at those cases on a case-by-case basis.
Any other comments?
I just,
Wait a minute. Go ahead. And Brenda, then you, Mr. Gentry.
Okay.
I'd just like to thank you, Dr. Williamson, for explaining that every board meeting, because I know that question is asked at every board meeting. And I thank you because I know Terry, why he's saying it, because sometimes it's what's told to us. That's all. So we thank you for that.
Mr. Gentry?
I was not able to attend the meeting, but I have gone back and viewed the video of the meeting. And what I was impressed with probably most of all is the way this classworks is geared towards individual students and where their aptitudes are and where they can go back and review and bring their skills up to a level that it shows that they're making progress, and it is more practice-based, which is long overdue in our instructional mode, is to make it applicable and relevant to the students in their everyday lives. And I see this as a great leap towards that.
It is a time saver because once they take those assessments, the standards that they miss, we load it in the classwork, and then it creates the individual lessons for the student, less paperwork for the teachers. So it's really a good system that we have in place.
Any other comments or questions?
Sir.
Thank you, sir.
I heard,
Before we get to you, Dr. Williamson, we move to public comments up here. At this time, we'll talk about the public comments of people. And with Grady, probably to Grady on this, because people ask about coming to the meetings, there's people who want to do the public comments to 3 minutes and stuff. And I defer to Grady and or the superintendent as far as their thoughts and process. Grady?
Well, I mean, Mike, we've closed it down because of obviously COVID protocols and social distancing and masking and that kind of thing. And until we get to that percentage where it's safe for the public to attend the complete meetings, I'm not sure how you fairly open it up to just folks that want to make public comment. Because when you open it up to everybody that wants to attend, period. That's the public. I mean, that's what it's, the open meetings are about. But under our current circumstances, we're making that available virtually for folks to attend. So, I mean, that's a call. It's left up to the board. If the board wants to open the meetings up somehow, but again, I don't know how you do that and do it safely and responsibly in this environment.
Let me ask you this, Grady. Let me ask you this. As far as public comments go, people that log on to the system, just like board members and you right now and Randy, if we allocated or advertised that we were willing to take the public comments and so send in their requests and what they were going to talk about, could they go virtual and we could put them on the conference for 3 minutes and do it like that instead of opening the whole floor up?
Well, I'm sure Cole, we could probably, and Cole could better answer this than I can, but I'm sure Cole can have a dedicated link for folks that want to participate during public comment. Let folks log on to that, but we need to have a system in place to let folks sign in and complete their forms just like they would if they were at a regular meeting.
Right.
Where they're going to tell us, who they are and what the discussion's about.
What's your thoughts on that, Cole?
Board members, I can tell you that currently there is not a system in place that has that capability that we currently have. We're getting ready to undergo a renovation project that's going to kick off tomorrow and is hoped to be finished by the end of the month of January. We can try to get something in place, but I can tell you if we had to leverage the current equipment with the current system that we're currently using, it would have to be with setting up different meeting environments, and there would be different sessions. So you would have a public comments meeting, which would probably have to start off the meeting at the beginning, how we used to, where that was the first thing on the agenda. And once that public comment session was finished, we would disconnect temporarily and switch to a private meeting. Because if you open it up to the public, you're not going to be able to keep the public out. You would have to kind of segregate the meeting into different sections so that you didn't have someone jumping in and trying to interrupt during the meeting.
Okay. Terry, you got a question?
As an alternative, Mr. Mike, if there's any interest among the other board members, what do you think about having somebody read the comments on behalf of the individuals? I'd be willing to do that on occasion.
Read the public comments?
One of us, or have some, we just.
Like that you volunteer.
What was that, Mr. Mike?
Like that you volunteer.
I have no problem doing that. I'll read them on.
Have we got any public comments? I don't even know if we have any. Do we have?
There are a few for this evening.
There are a few. So what's the pleasure of the board then? We all like to read them just so, I know they go on record, Craig, you were chairman last year. They go on record and we put them in the minutes, correct?
They go on record and they're put in the minutes. That's correct.
Yeah.
Mr. Chairman, I go to the website to look at the public comments, because even if it's said, we can't discuss them.
Right.
It's read and that's all.
Yeah.
So I'm good with going online to read. And I do check into some of what I do read, but I do read it.
Yeah. What's the thoughts?
Well, we want the public to be involved, and I mean, if this is the way that we can, have their input on things or discuss things, then
I think it's a right that we should not ignore, that we should give that privilege, whatever fashion we agree as a whole to implement it.
Correct.
I will say that, Mr. Cole said we couldn't do it. I don't particularly like the idea of people being able to speak there and we can't see them, on public comments. And I know, and I will say this, reading them, and they've been there public where you can see them. If we start reading them, just be aware, you have to read everything that's written down. And when you read everything that's written down, sometimes it's not very nice. So you can't pick and choose what you want to read.
That's right.
That's what I'm saying. Which I have no problem with somebody coming here and saying, what they have to say as long as they're following the guidelines. If we read them, you have to read everything.
Well, it probably can be expedited a little bit, can't it, Grady? If let's just theoretically say we're gonna start this and we're gonna read next month, we're gonna start reading them, and we got 5 people, and somebody writes in and starts talking crazy about an individual board member or calling somebody or whatever. I mean, we can compromise that some, can't we, Grady?
Well, I mean, you can compromise it as much as you could if they were live. In other words, if they've written it down, you treat them the same way as if they were in front of you. What you're going to let them say in front of you, you let them say in writing. I'm glad Terry has volunteered to read them. I certainly don't want to be the one to read them.
Mr. Chairman, I will say, if I may, I do not agree with allowing them to come inside our meetings. I will say that.
Yeah.
I don't want you to read any from anybody. I love reading it, and if there's a concern, I'll call Mr. Vibe, or whomever it is that I need to call for it.
All right. What's the pleasure? It's information right now. Let's see, Dr. Manuel.
Why, since things are going as they are with the COVID, why not leave it as is for right now? That's my opinion. I would not be comfortable reading them, and it's something accosting him, and he's sitting right here next to me. I would not be comfortable doing that. That's me personally.
That's fine.
If I read it.
That's the reason to put it on the agenda to talk about it and have discussion.
That's right.
At some point, if Grady comes and says, or Cole comes up with technology, or Grady says, or the health department says, numbers drop and we feel good about opening the door, I don't have a problem with anybody coming, and I listen to anybody say whatever they got to say. I don't have a problem with that, as long as they're courteous and professional. If they start cussing or having a fit, then I got a problem. But other than that, they're professional and do respectful and treat everybody right. Come on, Mr. Gentry.
If I heard Cole correctly, Cole, tell me if I did or not, that there is some technology coming at some point in the future that will enable us to allow public comment and have it in an orderly fashion. Is that coming at some point?
We're currently using the Google Meet system to leverage meeting capabilities within the district, as we're a Google Apps enterprise customer. Several other districts and businesses have done Zoom. Zoom gives you a little bit more capabilities, but we do not leverage Zoom and we do not license Zoom right now. Now, I can give you a number to where anyone could call into this meeting, but if we put that number out, realize anyone could call in at any point during this meeting, and I don't think you want that. Now, I could kick them out, but then I'd be sitting here for 2 hours kicking people out constantly.
So there are certainly some technology concerns that we need to talk about. Now, if it's the pleasure of the board that you absolutely want to do it and allow them to phone in, then probably what I would recommend is we broke the meeting up into 2 or 3 different instances, and we have the public comment portion at the beginning, and we could publish a number to where people could call into that. And once those were exceeded, we would conclude that portion of the meeting, and then we would jump over to a private line that no one else could get access to, that was just private to the board and invited guests.
Do that.
So if it's something you absolutely wanted to do, that would be my recommendation currently on how to do it.
Let's just wait. I'm just speaking for Mike now. And I appreciate Terry volunteering, but I think with everything that's going on, all the targets that are moving and as fluid as everything is, I think, at some point, Mr. Cole, if you come to us and you say, if you start jumping around to 3 or 4 meetings and I'm sitting at home and I'm trying to log in and then somebody over there trying to log in, I just want to do the public comments thing, or I want to attend the meeting. That kind of start crossing too many hairs in my opinion. So, at some point we'll open it back up. I just don't know that it'll be in the next 30 days or anything. Any other comments? Okay. Now we get down to action items, face covers and policy. Dr. Freddie Williams.
Mr. Chairman and members, I'm requesting that we continue our policy as now, option A, that is face mask covering mandatory in the building, on our buses, optional outdoors.
Second.
Have a motion by Brenda, second by Henry. At your desk, if everybody saw, I don't know who put this here, Dr. Williamson, got a state map of everybody's doing the face mask and the optional or whatever. Have a motion second, any discussion? All in favor, say aye.
Aye.
Opposed? Motion passed.
Thank you.
Next item is the Toshiba contract, Ms. Erica Setzer.
Good evening, Chairman Smith, Superintendent Dr. Williamson, and board members. I'm going to give it to Mr. McElwain. If anybody has any questions about the Toshiba contract that was presented in your package.
Make a motion to approve.
Second.
Motion by Dwayne, second by Vontae. Other discussion? How long is it?
5 years.
The 5-year contract?
And it will start once Toshiba gets all the devices out into the street, then that's when we're gonna need to get the contract signed.
Any other comments? All in favor, say aye.
Aye.
All opposed? Motion passed. Monthly financial report.
Make a motion to approve.
Second.
Have a motion by Dwayne, second by Vontae. Any further discussion? All in favor, say aye.
Aye.
Motion passed.
Thank you.
Chair, I move that the Board of Education for the Public Schools of Robeson County go into closed session for the purpose of discussing certified and classified personnel. North Carolina General Statute 143-318, 11A, 1 and 6, and to consult with the attorney retained by the board in order to preserve the attorney-client privilege between the attorney and the Board of Education for the Public Schools of Robeson County. North Carolina General Statute 143-318, 11A13.
Have a motion by Henry, second by Brenda. On closed session, all in favor, say aye.
Aye.
Second.
Got a motion by Vontae, second by Dwayne. Closed session, all in favor, say aye.
Aye.
Opposed? Pass. Motion for closed session, man.
For closed session minutes, Mr. Chairman.
A motion by Brandon for closed session minutes, second by Dwayne. Any discussion? All in favor, say aye.
Aye.
Opposed? Motion passed.
Approval as person.
Second.
Motion by Brandon for personnel as amended, second by Vontae. Any further discussion? All in favor, say aye.
Aye.
Motion passed.
Mr. Chair, I make a motion that we adjourn.
Have a motion by Vontae, second by Henry to adjourn. All in favor, say aye.
Aye.
Oh, no, you good.